You guys
The
need to see
parents
this.
of a college student are suing the company HIMS for a wrongful death of their son. This story does have some trigger warnings, so please be aware before watching. Although this lawsuit is happening now, the death happened in 2023. Luke was a college freshman at WSU at the time and received a targeted Instagram ad from the company HIMS. Within an hour, Luke was able to secure a 90-day prescription for bupropion. There was no phone or virtual meeting in order to secure this prescription, but Luke did disclose a history of depression and self-harm behaviors. 30 days later, that same provider issued another 90-day prescription, still without speaking to Luke. It's important to note that Luke was preparing for what is called Hell Week at his fraternity, which includes hazing, and he had gone through hazing previously. He had dealt with depression, self-harm behaviors, along with the transition to university, which can be hard for a lot of people. Sadly, Luke died by suicide with his prescription that he obtained through HIMS.
While I think telehealth platforms are so essential because they do make care accessible for patients who may not otherwise be able to see a provider in person, but when it comes to medications, especially for mental health, there needs to be very close follow-up, because when we look at the guidelines for treating moderate to severe major depressive disorder, usually in addition to a medication, the patient is usually going to go through what's known as cognitive behavioral therapy. If you're not familiar with cognitive behavioral therapy, pretty much what it is it's like personal training for your brain. It really helps you spot those automatic negative thoughts that you may get and question if they're actually true, and then you can replace them with more realistic and balanced ones. Because our thoughts, feelings, and behaviors are all connected, even like a shift in one of them can improve all the others. And this is actually one of the most evidence-based treatments for anxiety and depression, which, if I'm assuming, it definitely was not done or maybe not even talked about during his consultation. And then when it comes to the medication chosen, bupropion is actually a good option for someone with major depressive disorder. This is pretty much a full list of what the provider could have chosen, but with these medications, it is so important to let patients know that it can take 4 to 6 weeks for it to work. As she talked about that black box warning, I always counsel patients that if you start feeling worse, let your provider know right away, which, if I had to guess, was probably something that was not discussed during these very quick appointments.